My favorite moment, certainly the Uromigos Cup, the inaugural Uromigos Cup. We first got a glimpse of a cup earlier on when Brian unveiled it in a dramatic fashion. And then there was a, I guess, game show type contest with improvised rules as the contest went on. That I thought asked interesting and provocative questions, and I think got really good both audience engagement and certainly engagement from both teams. So I think it was very cool. We're looking forward to the next semifinal tomorrow, and then I think the final as well. I think what I really appreciate about this meeting, this event, just the podcast that sort of generated this in general is additional discussion of data already presented, and specifically how Brian and Tom do a great job putting certain things into context. So earlier today, for instance, we were discussing, or the first session was on the recent data in urothelial cancer and bladder that was presented at ESMO with the positive EV302 study, the positive CheckMate 901 study. All of us, I think, are familiar with that data. We've gone over it multiple times. Many of us were at the meeting at ESMO where this was presented. But it's specifically putting this, especially the CheckMate 901 results, in the context of prior trials that were negative, the Keynote 361 study, the InVigor 130, and the comparison of populations in those trials, specifically cisplatin-treated patients also in those studies compared to CheckMate 901, and really the discussion of really what this means and how CheckMate 901 is different, and whether it really is limiting patients to only cisplatin-eligible patients that led to this being a positive study. And I think that kind of was the general consensus. Then there was further discussion, of course, of whether it's immunotherapy upfront in combination with chemotherapy versus maintenance immunotherapy or checkpoint inhibition that really makes a difference in terms of the overall survival benefit in some of the studies presented. And I think that was actually a very interesting discussion as well. And I think there were interesting points of difference between the various discussants, between Matt Galsky and Tom Powles. And I think, these are the exciting things for which we come to meetings like this. So I think that was very interesting. I thought the session on non-muscle invasive bladder cancer actually was very interesting as well. There's a lot of new data presented just recently at ESMO, also at prior meetings. In this space, it's a very dynamic space which now medical oncologists actually are paying more and more attention to. Previously, it was really more of a urology space. I think it's great that additional attention was paid at this meeting and to discussing this space as well. It was certainly surprising. I think taking a step back and thinking about where we were about middle of last decade when multiple of these large frontline trials started. So InVigor 130, Keynote 361, CheckMate 901. There was also Nile and Danube studies, of course. And there was a lot of excitement about combining checkpoint inhibition with chemotherapy relative to standard of care chemotherapy for frontline metastatic urothelial cancer patients. And this, of course, was inspired by some of the activity seen with checkpoint inhibitors in this disease, and also by extrapolating results from experience with other malignancies, like in lung and others. And so initially there was a lot of excitement for this combination of chemotherapy and immune checkpoint inhibitors up front, but then a couple of these trials came back negative. There was initially a PFS benefit in InVigor 130, but then no OS benefit, and Keynote 361 was a negative study. And then we didn't hear from CheckMate 901, or at least this specific analysis. There was another earlier analysis of CheckMate of this study as well, comparing to Ipi/Nivo that was negative. But this specific analysis limiting to cisplatin eligible patients and comparing cisplatin gemcitabine to cisplatin gemcitabine nivolumab That we've been waiting on those results for a while, and I think it was really a surprise to a lot of people when the positive press release happened just earlier this summer, that this was a positive study. So yeah, I certainly was surprised. I think most folks were as well.